With us is Dr. Paul Offit, Dr. Vin Gupta, and now joining us as well is former CDC Acting Director Richard Besser. Let me start with you, Dr. Offit, because you've been watching from the beginning of this Q&A. What is your reaction to what we have heard so far?
So what he has said, RFK Jr. has said, including when he was running for president, is that he believes that vaccination has simply substituted chronic diseases for infectious diseases. So therefore, his war on vaccines, he believes, is a war against chronic diseases too. And that's why he's doing everything he can to make vaccines less available, less affordable, and more feared. I don't think people realize just how much of an anti-vaccine zealot he is. And he's a zealot against vaccines because he believes that vaccination causes chronic disease. He doesn't say that here, but he certainly said that many times before.
Dr. Gupta, your thoughts on what we've heard. And I know you've heard some mistruths by the health secretary.
Yeah, I think it's easy for him to be dishonest here, not to be held accountable. So I'll try to do it very quickly. You know, they talked a lot about the Rural Health Transformation Fund as though it's some balm for the big, beautiful bill and the impacts it had on Medicaid specifically. Just for your viewers, it's a $50 billion funding mechanism to support rural hospitals over the course of the next 6 years. It does not come close to offsetting the $807 billion that they're cutting that also impact rural hospitals, every hospital across the country. On a 1 in 5 healthcare dollars in the U.S. are Medicaid dollars. So this notion that the Rural Health Transformation Fund is transformative and will be a boon is false. Nobody thinks that. He talked about how American physicians and healthcare providers love him. Frankly, from my vantage, nothing further can be from the truth. 79 medical societies have had to bandy together to issue counter guidance, working with entities like the Common Health Coalition. They wouldn't have to do that if they were in favor of his policies. So this notion that he's positively received by the majority of healthcare providers across the country, again, there's no proof points to that. The people that he has on his staff are not folks that are broadly respected by their medical peers. Lastly, just say burden of disease. He kept saying that the burden of chronic disease was the fault of the Biden administration. I direct all your viewers to the University of Washington's Institute for Health Metrics and Evaluation. They have beautiful visualizations of what impacts our communities across the country. And Anna, the epidemic of chronic disease dates back decades. It is not, and across administrations, we have to wrestle with it. It's a real healthcare problem. It's what we should be focused on, but this is not the result of the Biden administration.
And Dr. Besser, one of the more fiery exchanges we've heard so far was when Senator Wyden asked RFK Jr., the Health and Human Services Secretary, about the firing of Dr. Menarez as CDC director just last week. And he cited the op-ed she wrote this morning ahead of this hearing, in which she wrote, quote, "I was told to pre-approve the recommendations of a vaccine advisory panel newly filled with people who have publicly expressed anti-vaccine rhetoric." She says she refused to do that. That was reason given to her for her firing. When asked directly if he said that to her, he said no. And he went on to reveal that he has never had a private meeting with Dr. Menarez. What do you make of all of that?
Well, I think we're hearing a number of different stories. You know, when I spoke with Dr. Menarez before she was fired last week, she was expecting to be fired in the near future for the very reasons she laid out in her opinion piece. She was being asked to fire talented federal employees who lead so many of the important areas at CDC without cause, and she was being asked to agree to approve recommendations out of a committee that clearly has a strong anti-vaccine agenda. And she declared that she would never do anything illegal, such as those firings, and she would never do anything that ran counter to the science. You know, what we've been seeing from the secretary from the moment he took office is a strong anti-vaccine agenda. And I can tell you, as someone who practiced pediatrics for more than 30 years, there was nothing I did that had more proven value than making sure my patients were vaccinated fully and on time. And what we saw in Florida yesterday, where the Florida Surgeon General says they're going to remove vaccine mandates, is a direct result of having a Secretary of Health who doesn't believe that vaccines are a good thing for our population. And this is going to have dire consequences across the country.
You signed onto a New York Times op-ed with 8 other former CDC heads arguing that Secretary Kennedy is endangering public health. Yesterday, 1,000 plus current and former HHS civil servants signed an open letter calling on Kennedy to resign. Have you ever seen such widespread dissent from the medical or healthcare community about the guidance coming from the top?
You know, I think an important thing to acknowledge about the opinion piece that we wrote is that we had people on this opinion piece from every administration, from Jimmy Carter up through Donald Trump. And these are individuals who cut across the political spectrum. And we all feel the same way, that our nation is at great risk because Secretary Kennedy has such a radical view of health, and that he should not be the Secretary of Health. So I'm glad that there's a hearing going on now. I hope that Republicans step up and challenge this as well, because the impact of Secretary Kennedy as our secretary will be felt in every single state. Rural communities in particular depend on our public health system, and they will be hit extremely hard.